Right. Hello. I've got Gobshite with me. Say hello, Gobshite.
I'm going to nut you in a minute.
Right. Anyway, first of all, I'm going to start by saying that prostate cancer is the second biggest cancer that affects men. First one being lung cancer. Didn't know that, did you?
I didn't know.
No. Then it's prostate cancer. But prostate cancer is one of the most easiest ones to cure if you catch it in time. If you don't catch it in time, you're fucked. So it's one of the easiest ones to cure, but it's also one of the biggest killers in men because they catch it too late.
Because men don't talk.
Well, I was going to get onto that later. So, where shall we start? Where should we start? Well, I'll start by saying, always listen to your wife, because she noticed something wasn't right. Just because I was getting up more during the night for the pee, and you kept saying, go to the doctors, didn't you?
Yeah, because I could hear you weeing on the toilet, and your wee was like starting and stopping. It wasn't a continuous proper flow.
Right, so I didn't realise that, but she kept saying things to me. And as a man, as we all do, we all say, don't be stupid, I'll be okay. And that's what I did. And then I started feeling really low and depressed all the time, and I knew something was wrong, but I just couldn't put my finger on it. So we went to the doctors, told them I was feeling depressed and low. Linda come with me, and they put me on some sertraline, which was absolutely brilliant. I'm still on it now. Done half balance your head, makes you feel great. And then I was just about to get up and leave, and Linda said, are you not going to tell them about the other thing? And I said, oh, right, yeah. So what I'm going to tell you now is something very personal to me, and a little bit embarrassing, but I'm not bothered, because if what I'm telling you saves one person's life, it's worth the embarrassment. So what it is, so we've got the peeing stuff. That was a symptom of prostate cancer, which I didn't realise. And the next one is my erections. I could get an erection. Here we go. What off? What off? There's always one child in the room, isn't there? Eh? Right, so I could get an erection, but it wasn't like it used to be. I used to be able to hammer nails in the wall with it, right? Whereas now it wasn't so strong, and it wasn't lasting like it should last. It'd just go like that. And so I said to the doctor, I said, look, I can get an erection. I said, but it's not strong and it's not lasting. And then cheeky bitch, said to me, well, you are getting on a bit now. It does come with age. And I'm thinking, hold on a minute. There's still plenty of life left in that little boy down there yet. But then
Little being the right word.
I know. Makes you do this, doesn't it?
No.
Yeah. Anyway, so she turned around and she said, just to put your mind at rest, we'll send you off for a blood test. Just to check your prostate levels, your PSA.
No, that wasn't right.
It was.
It wasn't. So first of all, you kept saying you think your testosterone's low.
All right.
So,
yeah,
so the doctor was just about to say, well, you can go now. And then I said, and I said, well, you wanted to mention about a blood test for your testosterone. And she said, well,
oh, that's right, yeah.
And she said, oh, right, okay. She said, yeah, we can do that. And we'll while we're in there, while we're doing it, we'll throw in a prostate one as well.
Because I thought that I was having problems with erections because my testosterone levels were low. So I wanted to get them checked. And that's when Linda she mentioned then we'll check your prostate levels. So we done that, and then did I wait about 2 weeks?
For your blood test? No.
No,
it was only a couple of days.
Oh, right, okay. Excuse me. Well, your prostate markers are supposed to be 0.3 or below, and mine came back as 17. So she was on to me straight away. We need to see you. So straight away you know something's not right. But a high PSA can also mean it's just a large prostate. As you get older, your prostate does get larger. and that can send your PSA levels up. So still doesn't mean it's cancer. So in my head, I'm thinking, yeah, just got a enlarged prostate, that's it. So then she says, we need to send you for a biopsy. So I didn't even understand what a biopsy was. So I gets a letter from the hospital, rings them up, says, what's this? And he says, oh, you booked in for a biopsy, a prostate biopsy. And then I said, well, how'd you do that? Now then. So they said, well, what we do is we get a camera that's on like a big fucking dildo, and they shove it up my ass. And then that bit of skin between my balls and my bum, they stick a needle through that. And they scrape your prostate and pull the samples out with this fucking needle. And then they send that off to be checked. Now I said to him, right, and will I be asleep for that? And he says, oh no, you'll be awake. I said, no chance, not a chance. My daughter works in theatre. What? Don't say what?
No, don't.
No, it's okay.
No, because you're going to get Tiff in trouble.
No, I'm not. What, just because I don't want people she works with seeing me bits?
Oh.
Yeah. My daughter works in theatre. So all the people who are in the theatre, who are looking down, because my legs are up in stirrups like this, my balls and everything's hanging out, and all these people who work with my daughter are all there going, ooh, look. No. Not while I'm awake, they're not. So I said, not a chance. Put me sleep. So they did. They put me sleep. So that was good. And then did they?
Then they said it'd be. Did they say it'd be 2 to 4 weeks?
Yeah, 2 to 4 weeks for the results, and that seems like 2 to 4 months because you're just waiting. You want to know. And then one of the nurses, the oncology nurse, rings me up. She said, we've not forgot about you. There's a meeting on, was it the Wednesday?
Yeah.
There's a meeting on Wednesday where we discuss your results. And then we have another meeting again to discuss the way forward, what's going to happen and all this. And then I said, so what are my results then? So she says, well, I can't really say until we've had the meeting. Straight away, you've got your answer. She's rang you up. They're having a meeting about it. She's not ringing me up to say, good news, Mr. McSorley. It's all clear, nothing to worry about. So I knew straight away. And she said, I can only tell you on Wednesday when we've had the meeting. So
well, she actually said, didn't she, would you prefer it if I ring you?
Yeah.
Or do you want to wait? Because we had already got a meeting planned in with her on the Monday. And she said, do you want to wait until we all have our meeting together? Or would you prefer me to ring you? And you said, well, I'd rather know sooner rather than later.
Yeah.
So she said, okay, well, I'll ring you after the meeting.
Yeah, so she rings me up. And she says that there was tumours on both sides of my prostate, cancerous, 40% on one side, wasn't it?
Yeah.
Yeah, I can't remember what the other side was. It was the other side was lower. So they said, got to go in, discuss my options, which they've offered me radiotherapy or surgery to take the prostate out. Now, I was and ahhing which one to do, because I've not got a problem with the surgery, it's what comes afterwards. So with radiotherapy, they can target the cancer, destroy it, and it's 95% thinking that it's going to work. But if it comes back, then they can't remove, well, they can remove the prostate, but it's very, very difficult because you've had radiotherapy on it. It's like trying to get chewing gum out your hair. That's what your prostate's like. It's so difficult to get out.
And she also said that they had to leave a little bit of it in, so that then it could potentially go into bladder cancer or bowel
cancer. Yeah. And the other option is surgery. And with the surgery, they take the prostate out. Now, with that, 3 to 6 months afterwards, I'm going to have problems with weeing myself. Not actually really pissing myself, but dribbles. I'm not going to be able to control it. It's going to be dribbles coming out. So I've got to wear pads, which is bloody great. So, and also erectile dysfunction. You completely lose it altogether. Doesn't work, and it can take 12 months or 2 years for it to come back, but they say it will come back. They say I'm still young, it will come back. Now, the odd part now, and this is what freaks my mind out, when it does come back and we decide to have a bit of tomfoolery and I'm getting to that climax point, there's no mess. Nothing comes out. I still have an orgasm, but nothing comes out. That is weird. That is so weird, isn't it?
Not really, no.
Oh, okay. It is to me.
So you're in the middle now at the minute, aren't you? So we've had the diagnosis. When we went to see the surgeon last week, he said that he recommends surgery.
Yeah. And I did say to the oncology nurse, I said, if I was your husband, what would you be telling me to do? And she said, get it out.
Yeah. But because the surgeon said, oh, it's probably not anywhere else and it's probably this. So I said to the surgeon, can I just stop you there? Because you said probably not anywhere else and probably this. Is it anywhere else or isn't it anywhere else? And he said, well, I'll tell you what, we'll send you for a bone scan as well. And they don't normally do that unless your PSA is over 20. So they're being precautious and sending him for a bone scan now.
That's in about 2 weeks.
Yeah, so now we've got to wait for that.
Well, that's a full body scan.
And then they arrange a meeting with the radiologist. Is the radiologist? Is that what they call it? Radiologist and the surgeon to see which option you want. But you've already decided, haven't you?
Yeah.
That you want the surgery. So we're going to see if you can cut out that middleman and just get on the list for the surgery, aren't you?
So I've opted for the surgery. It's going to be a tougher road to get down than the radiotherapy because of what comes afterwards with it, but I'll do it. I'll get there.
Better to get it taken out.
What else was I going to say? I was going to say something and you butted in as usual.
No, it's because you're just chatting shit.
Chatting shit. What was I going to say? No, it wasn't. What was I going to say? Oh my God, I don't know. But one of the things I was going to say as well, but it might come back to me in a minute. So for me, I'm not a big talker. I don't let Linda see my emotions. I don't talk about anything. So I would say, anyone out there, speak to your family. Get it out, let it out. There's some things like you don't want to worry your partner. You don't want to upset them. And so you're cautious of what you might say. Sometimes Linda might say, are you okay? Do you feel okay? And I'll say, yeah, I'm okay, thanks. Inside, I'm thinking, no, I'm not. No, I'm not. So you need your family around you and you need people on the outside around your friends and all that as well, because you can talk to them, whereas you can't talk to your family because you don't want to upset them and you don't want to make them worried. There's another person I talk to, which Linda knows about, and sometimes I talk to this person and it lifts me up, and sometimes I can talk to Linda and she'll lift me up. And I've got my mates and that, so I've been quite fortunate really. I'm quite lucky. I've got a lot of people around me, so that's good, and you do need that. I tell you, you do need it. I can't remember what the other thing was I was going to tell you.
Well, you just wanted to do this video, didn't you? And more to come down the road.
Yeah.
Just to make people aware.
Yeah. When I've had my scan and I'm ready for the surgery and all that, I'll come back on and let you know how it's all going, what to expect.
But they're saying that your numbers say that it's not gone anywhere else. Your MRI says it's not gone anywhere else. So it's just a precaution, and then you've caught it really early, and they caught it really early.
Prostate cancer's not
an
aggressive cancer like other cancers. Now, when you get told you've got cancer, straight away your head's working overtime, and you're thinking, what if tomorrow the cancer decides to ring an Uber and go for a ride round your body and think, oh yeah, I think I'll settle here. So that goes on all the time in your head. Even though they've assured me it isn't going to move, it's going to stay exactly where it is, it still plays mind games with you. So you just got to try and get your head out of that area and just think positive and crack on. Now, I have got a couple of friends on here whose husbands are going through the same as me right now. So they know exactly what I'm talking about, and I hope everything goes well for you. But yeah, I can't remember what the other thing was I was going to tell you. So that's it for now, and then when we know some more, we'll let you know, won't we? And now we're going to have loads of sex now because
Like shit we are.
I need to get as much as I can now before it dies on me. Okie dokes. Cheerio,
Ciao.
guys.
Ciao for now.
Ciao for now.